Everybody had a chance to read those? And I'll take a motion. Motion from Tim, second from Ralph. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Jill, Master Facility Plan update. Welcome.
All right, we're going to switch to our slides here, show the overall projects. All right, there we go. So temporary parking, as you are aware, is completed. We are finalizing the closeout with our team, and so that will be, the project's completed, but the actual accounting piece will be completed next. Medical Home Southwest, the PEC and parking garage, I'll provide an update in a moment. Medical outpatient building, we are in design currently with our teams, and so cost estimating as well is it's underway. Central Utility Plant, again, that program's finalized, and we are beginning the SD and cost estimating for that particular project. And then the hospital addition and the Pavilion North expansion, we have completed our SD 1 and 2, and actually we go into SD 3 next week. And again, we will begin cost estimation this month. Next slide. Talk a little bit about, that's the original budget. So next slide, please. Medical Home Southwest, as you know, we are live and open with our Medical Home Southwest. The go live was on February 24th. This past Friday, we additionally opened our pharmacy, so that is now open and live as well. And we will start beginning to close out this project. We are finalizing some punch list, a canopy, some final millwork, kind of the normal things that we do with any project. Next slide is our Psychiatric Emergency Center. You know, you guys probably saw that today. Out my window, you can see we're actually, the parking lot now is getting, you know, concrete and paved as we speak. And so we are finalizing the schedule for that and working with Vaughn, our contractor, with substantial completion, final completion, as well as the actual go live. This is different than a medical home, and so that go live will be really important to have every piece of our construction completed and done as we go live with the PEC. So sometime late summer is what we're anticipating, but again, working with Vaughn on the actual date for substantial completion, final completion, and then our go live date. The new parking garage, next slide. Making great progress with that. They're starting to lay all the actual grounds of the particular levels of the garage. We're working and looking at finalizing some flows in and out for our staff coming off St. Louis, making sure that we have enough equipment to ensure that flow is going to move, you know, swiftly through for our staff members. So again, right now, trending ahead of schedule for the parking garage, looking for you know, spring, summer of 26. And so things are moving along quite well.
Jill, let me ask you a question on the parking garage and just programmatically. When that is finished and open, are we going to be transferring any parking from the existing garage to that? Or
yeah, the timing. Yeah, the timing will be such that that will be open before we take out the temporary parking and Morphe with the cup. Okay. And so the timing is going to be about next summer is when that part of the construction will start. And so it actually is going to work out really well from that perspective.
So has any consideration been given for those folks? It's a longer walk.
It is.
Now, so is there going to be any transportation alternatives or thoughts about how we move people in from that garage?
We'll adjust our shuttle schedule. Yeah, we have a shuttle schedule now with a couple of shuttles that are running all the way out to our remote lots on Main Street. And so what we'll do is update the schedule and the frequency of the different stops. Okay. We actually also have an app for our employees where they can actually see where the shuttles are and kind of where they're moving real time. That helps our staff. So.
And patients and staff will both have access to that. Will that be like a scan code or something that we can put somewhere where they can find that app easily?
Yep, absolutely.
Put it on their phones?
Yep.
I had a couple of questions about that. So that's good. Well,
QR code.
Everybody's looking forward to it.
Yeah, for sure.
All right. Thank you. I'm sorry.
And then the final slide is really kind of Rory's tracking of our funding for bond and for cash.
All right.
And that's all I have, unless anybody has any questions.
Any questions for Jill? Ramon, thank you for being here today. Like you guys are going to get off easy today.
Thank you. No, we appreciate that.
All right, fantastic. We don't have to take any action on that. That's just an update item. So we'll move to our unaudited financial report. Mr. McCready. Morning, Roy.
Not a lot outside the normal financial report to discuss. I would say we finalized our bond ratings. No changes amongst all four of those rating agencies.
Congratulations. That's
Yes.
a heck of an accomplishment, given the amount of debt that we've taken on. That's a major feat.
Yeah. And then, Trent, I know you asked for some things in the prior meeting around the impact of state and federal kind of legislative changes. We are working on that. It's a little early because a lot of those bills have not taken shape yet, but we are tracking those and coming up with those numbers.
Sure. Understandable. Thank you.
So the narrative has been provided for you as usual. We will start with a consolidated income statement. We are looking at the results for February. I would say there's three things that really impacted February: a little bit of favorable net revenue, as well as supplemental Medicaid funding. You will see that in the month of February, as well as the year-to-date number. And then also investment income at the bottom of your income statement is also around $4.2 million favorable for the month. So I'll explain net revenue a little bit. We have been waiting for the CHIRP payments to kind of resolve in our system. That has almost completely resolved. So that is the result of that additional CHIRP funding. The payers were able to hold that up until the end of March, but most of them have completed that reconciliation of what they owe us. And so that was the increase in net patient revenue. An additional 2 years of DISH audits were completed for 2018 and 2019. And we can have an increase or a decrease in DISH audits when those occur of funding. And so we had about 2 years worth, roughly $5 million each year. That was a gift. One of those gifts we did not see coming, nor would we budget for that because, like I said, it could be positive or negative. Retail pharmacy includes specialty. We continue to grow that business as one of our strategic initiatives. Year to date, you'll see that growth there. On the expense side, salaries really are a function of, go back to the income statement, please. We're not quite ready for the balance sheet. We are a little bit under on salaries year to date due to some of those changes in, we typically do annually for market adjustments. So that's the variance there, both monthly and year to date. The rest of the expense categories are pretty in line for the month, so I won't spend a tremendous amount of detail on the operating expenses. I will explain the investment income. As you look at kind of what's going on with interest rates, we are seeing somewhat of a environment where we anticipated a rate drop, and those rate drops were kind of foregone by the Fed. So that keeps that bond portfolio a little bit more favorable. A bond portfolio that's paying in a short-term 2-year, say that 4 to 5% is holding steady. So that's the reason our investment income is where it is. And we could see that change if the Fed does decide to impact rates. So, and then net income year to date, I would like to reconcile real quickly just for the board. Roughly 15 million of the net income year to date is the DISH refunds that I explained. We had a land sale totaling roughly 6 to 7 million, and then we had that 10 million in salaries that I mentioned, and then and just other expenses of about 12 million. So just kind of want to give you guys a rundown on what the variances are in the budget this year.
Questions on the income statement?
Okay, we can go to the balance sheet. Not a whole lot to report here. I would just say the one thing that sticks out is just the other accrued liabilities. We are up roughly 60 million there, 80 million. That is just a function of our local provider payment fund, LPPF. It's a timing thing with the LPPF payment. So that's the only thing really on the balance sheet that's really kind of looks abnormal to the prior year.
Ready?
All right. And then on the ratios, just a couple of quick comments highlighting overtime and contract. You see a better performance there over the prior year. Our operating days cash on hand obviously remain steady. And of course, days in AR continue to be real stable as well. So all positive indicators. We'll go to statistics. On the statistics, I would just point out year to date, very favorable. One exception is the commercial payer mix. We have seen that mix drop a little bit around that 8.5% year to date. We are making up for that with Medicare and Medicaid, which is, as you know, our Medicaid rates are very close to commercial rates. So we are making up for that a little bit. So it's not all shifting to charity and self-pay. So that's a good thing for us that we're making up for that. ED visits are on pace to exceed 121,000 for the year. The one thing that has been a topic is CMI. We might reserve that discussion for a different date, but I can give you a couple of things. One, Medicare changed the weight tables related to CMI, and so our proportion of cases has been affected by the weight changes, and then NICU is also one of the things that's sticking out. We're having healthier outcomes with labor and delivery, and that's driving our NICU volume down. So that's an indicator as well.
Any notice within, and maybe it does or maybe it doesn't, does the change in our proportionate share of level 1 trauma cases reflect in the CMI?
It's reflective in the surgical CMI,
okay.
Yes. Not so much medical, but definitely surgical.
Okay.
If I could go to the metrics page next, I think it's the lab. We won't speak to any of the graphs today. We've kind of seen a lot of those.
I do have a question.
Yeah. Yes.
It looked like, and it's difficult for me to tell just from the graphs, it looked like med-surg admissions are up quite a bit, but I regret for our patients. Are we concerned that maybe we under-budgeted that area, or is there something going on in the community? That's maybe more for the medical staff, something that can be seasonal, and we'll see that trend out over the rest of the year.
I think part of it was seasonal. I think also we've been able to manage length of stay below target, and in doing so, we've been able to keep up with that additional need and demand. I wouldn't say we under budgeted admissions.
That's why I say it's tough, because in some ways it looks like it might be 10%, but maybe it's 5%, because I'm just trying to interpret the graph. But I mean, it's up quite a bit.
Yeah, we're just moving through more patients, and we've got more coming into the ED. That's where we get the majority of those are inpatient admissions.
Yeah.
So
what we would expect, January, February, you would think would be a very high flu respiratory virus season. Certainly from the ICU standpoint, I think generally in the hospital, while we've had some, this has not been like a pandemic, epidemic year that we've gotten a huge volume from. So my concern I share with you is that, at least from what we see, a lot of the seasonality we used to have is now a year-round phenomenon.
Interesting.
Sort of ebbs and flows of everybody. We will have massive surges of respiratory something or other, or another pandemic, epidemic, but not currently.
Yeah.
Good. Yeah. So, down, CMI down.
I mean, you would think, it's a good question and a thought-provoking question, but you would think commercial would typically be that healthier, younger population, so not necessarily as high as CMI. So Medicare and Medicaid might be a higher mix of CMI. So I can look at it by payer mix and see if it's impacting us. I don't have that in front of me.
And part of that could be level 1 trauma change too.
Yeah, some of it is surgery, level 1, but really what happened is each October, not to get into great detail, Medicare changes the weights based on their formula for what they think is acuity or severity. So as they changed those, our admissions fell into the areas where they lowered the weight. and our admissions in the higher weights fell. So that's the real explanation for it's not a coding issue. It's not a documentation issue. It's truly the weight changes.
We don't want to think.
I mean, certainly it's a good question to think through how a more commercial-based population might impact case mix. I think that's, I think in general, in the past, we've had the philosophy of all insurance is better than no insurance, right? So that mindset in the future would probably still be, holding true. But we can take a look at that and see if there's any major things that by pair mix, CMI. It's about 50% of our total Medicare. So fee for service is 50%, managed care is 50%. I think that's where we are working on that retention, that Medicare retention, and doing some great things within our medical group. So we've been focused on that for the last couple of years now.
Yeah. I agree.
Yeah.
I agree.
Thank you for the question on the admissions, and we'll go to the last page of the metrics there. I just would point out, I don't know who's advancing for me over there.
It's the person.
I don't have a clicker today. It's
On the curtain.
huh?
It's
It's behind the curtain. Okay. One more. Goals. Okay. Out of the goals this year, just did a quick rundown. 8 of the 9 are at stretch, and 1 of the 9 is at threshold. That 1 at threshold is length of stay. We did submit a pretty aggressive length of stay target for stretch of 5.35, and you can see we're running there right at threshold. But the rest of the metrics or goals are performing all at stretch currently. So that concludes my presentation, and would ask for any questions and a motion to approve if we're ready to do that.
It's an impressive report, and I think underscoring all this is the fact that as our staff becomes more efficient, especially in admissions, as we free up space, we can admit people. I mean, admissions go up, and we're so much better at that than we used to be, and the numbers reflected in a lot of different ways. And the other thing I would say is that, even though we continue to see really strong growth in ER, we're still around 1.7% left without being seen in ER, which are just really good numbers. I mean, you look around at this data and other hospitals, and that's a number to be proud of. And our group has done a super job maintaining that. So kudos. Oh, my word. Yeah, we don't even talk about that. Yeah, it really is. So congratulations, Karen, to the whole staff. I mean, it's nice when we get free money that we don't know is coming, and it makes the numbers look good. But under the numbers, there's a lot of basic data that's really quite related to activity that we're doing here at the hospital, and not just lucky to get it. So it's hard work and very effective. So we appreciate it.
Just a comment from the med staff around on the inpatient service in the CDU. I don't see the patients being any less complicated to you, Dr. Davis. So I think that really is a Medicare thing in a group. We're running at full capacity.
Yeah.
And the complicated patients out faster. I mean, that really is just a sense of data.
Yeah.
And I would love to take a deeper dive on that topic when you guys have time. I know today's not the right, but I can show you how they created those weight changes. It's really not anything systemic that we're doing systemically. It's really a function of the weight changes.
Yeah. All right. Any other questions for Roy? Good job. Then we need a motion to approve this financial report. Motion from DT, second from Tim. Any question or discussion? All in favor, say aye.
Aye.
Opposed, same sign. That motion carries. Thank you, Rory. We'll move to professional services agreement with Invigorate Healthcare Solutions.
Okay. Next. Yeah, just real quickly, we know that 60% of our labor our expenses, are tied up in labor. So as an organization, we are spending some dollars here with Invigorate to guide us through that operational assessment and reduction of labor costs. We know that just based on initial assessments, this $3.6 million we're going to spend will translate into an identified $40 million in additional savings. So that is the purpose of the agreement. We did do an RFP and have selected them for the work that we would like to do in that labor initiative.
Are they a new provider for us?
We have used Invigorate in the past, probably back in the 2020-ish timeframe. We have a good confidence level with them, and also they were affordable given the other options.
All right, any questions for Rory on the Invigorate contract? Not, we need a motion. Motion from Ralph, second from DT. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries, and that'll take us to our third amendment with United Behavioral Health.
Okay, quickly, this is a managed care agreement. Previously, we provide services in the behavioral health area for what's called partial hospitalization, intensive outpatient, two different services. We were getting paid for those at a contract default rate, so we have carved those out now, and they have a specific reimbursement rate, which will protect us from authorization issues. So this is actually just a protection mechanism for us to call those out in the contract and make sure we're getting paid for those services.
Questions for Rory on this contract? If not, we need a motion. One from Dr. Fowler, a second from Ralph. Dr. Fowler, was that Dr. Davis? Okay, Dr. Davis and then Ralph, right? Got it? All right, any question or discussion? All in favor say aye. Aye. All opposed, same sign. That motion carries. And that takes us then to Charlie. Rory, thank you so much, sir. Appreciate it.
You bet. Thank you.
Charlie, First Amendment on pricing agreement between Tarrant County and Medtronic. Welcome, sir.
Good morning. Thank you. I have two contracts for your consideration today. The first one with Medtronic is an extension and modification for the remaining 3 years for ENT surgical products and implants. Estimated spend is about $225 annually for a total extension amount of $675, 1.1 over the life of the agreement. This was executed through an original RFP, so it's really just modifying, adding some products and extending for an additional 3 years.
Okay. Heard the staff recommendation. Any question or discussion?
Yeah, super pricing.
Some modification on pricing with the addition of new products.
I need a motion.
So moved.
Motion from Tim, second from Ralph. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. That motion carries. Thank you, sir. And we'll go to pricing agreement, exemption to bid and pricing agreement also with Medtronic, right?
Correct. This
All right.
is a separate division with biosealers, monopolar sealers. It is a five-year agreement as a result of a RFP. This is an exemption to bid. These are tied to existing equipment that we own. So these are the bipolar sealers. Estimated spend is about $300,000 annually, 1.5 for the life of the agreement. And this is technology that we've used for quite some time and have owned the equipment.
Okay, so we need a motion that will consider the request for exemption as well as approval of the recommendation. Motion from DT. Second from Dr. Fowler. Any question or discussion? All in favor say aye. Same sign. That motion carries.
Thank you.
Thank you, Charlie. Good to see you today. Phyllis, we're ready when you are. Good to see you. Thanks for being here today.
Absolutely, always a pleasure.
Transaction between Tarrant County Hospital District and Intuitive Surgical.
Yes, so I have for your consideration a contract for a Da Vinci robot to house at Jessica. It is for $3.8 million over a 7-year term fully. And it is, of course, to place our outpatient surgeries appropriately at the Jessica campus. And this would be an add to existing robots that we already have in-house.
Any questions?
I mean, my only complaint is like, this is the third or fourth one of these that we've done since I've been here, and I've never done it.
So we have you scheduled
Okay.
shortly after the meeting so that every robot will start to.
Careful what you ask for.
Ralph and I were talking about it. We want to
But this is standard of care and.
Absolutely.
New surgeons, so they want to know that you have this there. So the fact that we're able to do this in the outpatient area.
Absolutely.
Docs are just really.
Speed up recovery time, all of that. I'm sorry? We do not currently have one in Jessica.
So have a motion and a second.
I love it. Thank you.
All right, who made the motion? Dr. Fowler, who made the second? I wasn't paying attention. Dr. Davis? All right, any question or discussion? All in favor say aye. All opposed, same sign. As it goes for both of you when it comes to that particular procedure, we route you through Zelia to begin that process. So, just so you know.
Be clear.
All right. Hi, Joy.
Good
How
morning.
are you?
Good. I'm bringing forward for your consideration approval of the construction manager at risk CMAR agreement between the district and Batson Cook. This amount is a total spend over 2 years. It was awarded through RFP. What this provides for us is the planning, the labor, materials, and supervision required for us to create some renovation within our JPOC buildings. This does allow us to stage and help support. It sits outside of our master facility plan, but is definitely a need as we prepare for the future.
Outside master facility plan, but not outside what was capital budget, right?
Correct. It's within our operational and capital, budget.
Any questions for Joy?
Are we moving those folks, or is it kind of a living renovation? They'll be there as an experiment.
Yes, they're going to be staged and consolidated in certain areas as we're renovating. So yes, a lot of moving pieces.
All right. Any other questions? Have a motion from Ralph. Need a second? Second from Tim. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Joy, good to see you. Thanks for being here today. And next at bat,
Always in with them.
we always end with Will.
Clean up.
You know that's a compliment, right?
Seems to be a common
It's
thread.
always a
yes.
compliment.
Yes.
The last person is considered the very best, most prepared, most efficient, the cleanup hitter. You're
He's
on.
got the highest.
Okay.
budget. The highest budget.
That's right.
So good morning, everybody. I'm bringing forward 2 contracts. The first one is with Network Consulting Services, and that's a VAR for Avante. Avante provides 3 functions for the organization. It's a tool that does both ticketing for IT and about 6 other organizations within JPS. It does asset management for us, and most importantly, it's the tool we use to push updates for patching for OS, et cetera. The cost is $1.1 million for a 1-year contract. We're asking for a 1-year contract because we're in an RFP process right now.
Okay, so there's going to be an RFP that comes out next year on this?
No, there's an RFP process right now.
Now.
We're in the final stages of selection.
Okay, so why wasn't this in the budget?
There was a portion of it that was in the budget. The full amount was not in the budget,
I see. Okay.
What's the bill?
about $500,000.
So a big portion of it. Was that a
Big portion.
surprise?
We're in the middle of an RFP, and I can answer those questions
Yeah.
off to the side.
Okay, fair enough.
Very close. That doesn't have the bets anymore. You round it up. Only you would notice that.
Well, yeah. All right, you've heard Will's recommendation. Is there any questions? Then we need a recommendation. We have a motion from Dr. Davis, second from DT. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Will, thank you. And Daphne, do we have anything for executive session? Congratulations, Dustin. Wow. You're going to make it. Buddy. You're going to make it. We're going back to the Steve Montgomery days where we get this stuff actually done and out of here. All right, that concludes our agenda. Thank you all for being here. We will see you next time. Thanks for being here.